This week, House Republican leaders released their long-awaited repeal and replacement bill, the American Health Care Act. What's notable about what they've put forth is that it significantly replicates some of the major provisions of the Affordable Care Act. So not only is it not just about repealing the ACA, it's replacing it by maintaining several of the key ACA provisions, which for those who are fans of the ACA is really good news. It's also clearly responsive to a lot of the pushback that Republicans have gotten from constituents and industry groups about things that they want to see maintained in the current Affordable Care Act. That being said, there are significant cutbacks to what the Affordable Care Act has provided to millions of Americans. And really, the key focus here is on the Medicaid program. While it allows states to continue expanding Medicaid to a certain extent, it then stops that and by 2020 actually converts the entire Medicaid program into more of a capped or per capita cap, almost like a block grant type of program. And that will have significant impact on millions of people because states will have a hard time replacing the federal funds that they have gotten used to having. Also, the other significant provisions are that the tax credits that are allowed under the American Health Care Act are significantly lower on balance than the ones that are currently offered through the Affordable Care Act. So while there will be some winners and losers, on balance, again, there will be less money available for subsidies. And while other provisions go into place, if they do, we could see insurance rates actually go up, and therefore those tax credits, which are lower to begin with, will cover even less. Some people have compared that to giving people a 10-foot rope, in a 50-foot hole. So we see some significant changes that will affect millions of people who currently have coverage and may find themselves no longer available to have coverage. I can't give you precise estimates yet because at this point, Congressional Budget Office has not scored the bill, so we don't know exactly how many people are projected to be affected, but we do know that millions will be on some level, and we need to just keep watching and waiting to see how this unfolds.